This video is going to be discussing something called the vasovagal response. We'll be discussing the vasovagal basics as well as signs and symptoms and the emergency response. Vasovagal is the common cause of fainting. It's mediated by stimulation of the vagus nerve, which is the rest and digest component of the parasympathetic component. Overreaction to a trigger, such as prolonged standing, sight of blood, stress or fear, contact with certain locations on the throat, sinus, and the eyes. In our office, we call this the vasovagal response or the reflex reaction. Basics, it's caused by sudden drop in heart rate and blood pressure, reduced flow of blood to the brain, a brief loss of consciousness or postural tone of the body. Usually it's alarming, but it's harmless. In fact, the fall is much more harmful than the fainting response. So the vasovagal response is the body's response. It then causes people to fall over because of the loss of consciousness and the postural tone. Prior to losing consciousness, patients generally will have reduced blood pressure and pulse, nausea, extreme hot or cold, tunnel vision, spots in their vision, confusion or daze, pallor, and perspiration. So our goal is to recognize the early symptoms and intervene early if we can. Protect the patient from the fall if we think that they may be possibly going to faint. Immediately lie them down on their back with their legs elevated because we want to get blood and oxygen to their head. Loosen tight clothing, especially around the neck, so if they're wearing a necktie or a tight collar. And then call for somebody else in the office or send somebody to get help. Notify one of the doctors. Expect the patient to regain consciousness almost immediately, relatively briefly after they faint. If they don't, then under the direction of a doctor, call 911. This could take 10 to 15 minutes for the patient to be fully alert once they lose consciousness, but they may start regaining some sort of consciousness. Be aware of choking or concussions or other types of injuries that they may have sustained from the fall, which certainly would require hospitalization if there was some sort of damage or at least be seen by an emergency room. Persistent hypotension, cardiac arrhythmia, altered consciousness, dizziness, chest pain would also mean that we would want them to go see somebody for an evaluation. And as such, we need to monitor their blood pressure and their pulse for at least 20 minutes past their return to normal, and hopefully those things will return to normal pretty quickly. Fainter's going to faint, so if somebody is likely to have a vasovagal response, we may want to try something different if at all possible. And if we do see somebody that's starting to become or look like they're going to faint, we certainly want to get them on the floor and start intervening and then have somebody go get somebody else to assist them